Welcome to my Spark session. It takes a village, the Maternal Wellness Village. I am Salima McNeil, founder and CEO of Oshun Family Center and the curator of the Maternal Wellness Village. We are so honored to be here today to the National Maternal Innovation Symposium. I hope you found value in our session today and you learn more about what we are doing in Philadelphia to combat Black maternal mortality. I'm going to tell you a little about myself, the team of amazing birth workers that I work with, and a program that we have to expand upon in October 2020. Again, my name is Salima McNeil. I am the founder and CEO of Oshun Family Center. Oshun Family Center is a nonprofit organization geared towards helping members of the Black community cope with transitions associated with perinatal mood and anxiety disorders. Also, those who struggle with the intersection of racism and maternal health, traumatic birth experiences, and infertility. As a therapist, I find it salient to address these issues to help circumvent some of those fourth trimester fatalities. Depression being one of the top 5 reasons that women perish in the postpartum phase. Did you know that Black women die 3 to 4 times higher than our white counterparts? But we'll get into that later. The mission of the Maternal Wellness Village is to function as an action-oriented task force by providing support services to empower communities throughout the African diaspora. Through our efforts, we aim to increase modern adaptations of ancestral birth practices, reclaim the Black birth experience, and reduce maternal mortality in the Black community. I want you all to meet these lovely women. Meet our team. We are the future, and the future is now. This team of Black birth workers is reshaping Black maternal wellness one family at a time. The Maternal Wellness Village is a program within Oshun Family Center. We are a village of Black birth workers that includes psychotherapists, doulas, lactation consultants, holistic healers, infertility warriors, and nurses. Combined, we have so many levels of education and life experiences that filter straight into this work. We also have over 50 years of parenting skills spread across all of us. 25 years of labor support with multiple doulas on our team, and 10 years of mental health support. I think that is very noble to note that out of all of the skills and levels that we have, there's only been 10 years combined for mental health. Also, with mental health being one of the many factors that goes into the Black maternal mortality rate. And last but certainly not least, we are mothers. And our experiences as mothers qualifies us to be on the front line to help other mothers and other families thrive in the 4th trimester. We do the work that we do because we have all had experiences within the medical system, within the overall system of being a parent, and it has fostered the work that we do, not only personally, but professionally as well. Too many Black women are dying before, during, and after childbirth. As survivors of traumatic birthing experiences, sufferers and survivors of postpartum mood disorders, and infertility warriors that some have overcome and some have not. We want to be very clear about what the issue is here. The issue is not our Black skin and the Black bodies that we wake up in every day. It is racism. It is the views and actions of providers who provide care for us that do not listen to us. I am a mother of a 14-year-old son, and my experience fostered the passion behind why I do the work that I do. As a personal survivor of a traumatic birth experience, and I know firsthand what it's like to be enthralled into a medical system, not have the full informed consent, which is the education behind decisions that I ultimately had to make, and or were made for me, and I know what it's like to recover from that experience. Throughout that time in 2006, when I delivered my son, I knew that our journey would look a little different than what I thought, look different than my family members, look different than what I seen on TV, and look different from our journey with breastfeeding. The hospital was adamant about providing my son with formula, but my resilience and perseverance to breastfeed him got us 13 months of breastfeeding. The top 3 causes of Black maternal mortality is cardiovascular problems, depression, and racism. It is our job to collectively do something about the system. We need to work together, not only Black, Indigenous people of color, but we need our white allies. We need the resources, and we need ultimately systemic change. So what the Maternal Wellness Village has done throughout the years to address racism is by doing trainings in diversity to institutions and agencies that solicit our support. So we go out, we look at the system that they have in place and how they address Black bodies and the implicit bias and unconscious views that they may have. We talk about our own personal experiences and how no matter the education level and or the salary, we are still victims of different social determinants of health that have nothing to do with what we know. It is strictly about how we are treated. We also work with legislators to not only change policies, but to write policies that impact Black bodies. In Philadelphia, one of our state representatives, Morgan Cephas, has been on the front lines of writing bill packages that impact Black bodies in order to improve maternal health outcomes, especially for us in the Black community. We also collaborate with community members to raise awareness. One of the major events that we do every year, we are going into our 3rd annual, is Black Maternal Health Week, which was started by the Black Mamas Matter Alliance in 2018. In 2019, we had a very small group of us women in the village, and we were able to put on 3 events. In 2020, we had to pivot due to COVID-19, but we knew that it was gravely important for the major players in the field, stakeholders, policymakers, and community members to get the information that we needed. So we had 5 events that we pivoted to a virtual platform in order to still reach the capacity and people who needed the information. That is one of the main events that we do every year to raise awareness, to challenge our legislators to really work collaboratively to dismantle a system that has not been geared towards treating Black bodies well for generations. Introducing to you all our program. We are striving to find the optimal path to Black maternal health. What you see here is phase 1. And what we have is parents who are newly pregnant, just going to their first appointments. They have their support person there, and now they're starting to look for those supplemental services to help them make it through. When we look at the sun that we have here in the middle, Black mothers and babies thrive. They cannot thrive unless they survive. And we need our systems to get in place in order to support that. When we look out over a sunset or a sunrise, we want to see cultural humility, respectful maternal care, community, resilience, healthy birth outcomes, increased breastfeeding rates, increased mental and emotional well-being, healthy blood pressure, and heart health. And we are all working together to make that the outcome for a brighter future. The second phase is when the family is looking for supplemental support. We pair women, Black women specifically, Black families, with Black birth professionals. So here you have in the 3rd trimester with a psychotherapist. We provide a comprehensive evaluation during pregnancy. If it is determined that that mom needs psychological support, we support her and give 12 free therapy sessions to be used during and after pregnancy. If at that point in time it is not determined that mom needs therapy, we do another evaluation in the postpartum phase. And at that time, we still offer 12 free sessions. We also introduce a doula during the pregnancy that will provide emotional support through those transitions when that family brings their human earth side. That doula support is essential, and unfortunately, a lot of doulas have been banned from hospitals due to the global pandemic. We also incorporate a component for lactation support. So while we are all working together to build this village, each participant will meet with a lactation professional to not only go over breastfeeding strategies and interventions if need be, but they would get an evaluation and assessment on their latch and or provided support on bottle feeding. You can bottle feed breast milk and or you bottle feed formula. We want to make sure that parents have the essential tools to thrive in their fourth trimester. And some people, unfortunately, don't know how to make a bottle. And so we are here to support them on whatever feeding journey that they have. This is the path to optimal Black maternal health. Starting in the first trimester, building your support in the third trimester, building support throughout your labor and birth. Also in the fourth trimester, we introduce group sessions. And that group can be about nutrition, infant feeding, newborn care. The peer support we find is really important because as birth professionals, we're able to support, but if you don't build that permanent village to continue on your journey, we find that it is very difficult. So with all of the components that we have here, this is a small part of a very large program that we work to develop throughout the years. And ultimately, when we branch off to engage in the other areas, when we want to do systemic work with other institutions and larger corporations to help dismantle a racist system, we are still here working together with community partners and allies to make this the reality. When we look at all three elements of this program, having the partner there as a support person can be a caregiver, a friend, an auntie. We really want to tap back into those ancestral roots. Women used to give birth in a room full of other women, their aunts, their cousins, their sisters. Granny midwives birth and help to birth a nation. So with this three-pronged approach, we are doing our best to tap back into that to help circumvent the fatal outcomes that arise for Black women 3 to 4 times higher than our white counterparts. This program is near and dear to our hearts, and we are so excited to continue doing the work and hope to get the funding that we need in order to continue to build this program out and offer it to more participants on a year-to-year basis. Over the last year with our services, we've been able to serve over 100 families. And that's just the tip of the iceberg. In a city where there are almost 9,000 Black babies born a year, there's so many more families to be touched. I wish I had more time to give you all details of what we have coming up. But instead, in this short 15 minutes, I hope you learned something about our organization, learned something about the Maternal Wellness Village, and the programming that we have for Black mamas. Thank you so much for having me, and this village will continue to be built as we all work together. If you found value in anything that we've talked about today, please feel free to contact me. Listed here is my email address. Take a look at our website that just got a facelift over the summer. And please follow us on Instagram for the latest updates of what we are doing at Oshun Family Center with the Maternal Wellness Village. Thank you, and I hope to hear from a lot of you soon.